Hello and welcome to Heart Matters Live. I'm Fergal McKinney, head of British Heart Foundation, Northern Ireland. This is the first edition of our new series of live Q&As where you'll hear from our panel of experts and get the chance to ask them your questions. Every 3 months, we'll be bringing you a jam-packed session centred on a different heart or circulatory condition. And today, we're focusing on atrial fibrillation. Atrial fibrillation, or AF, is a common abnormal heart rhythm that causes the heart to beat irregularly and often too fast. More than 1.6 million people in the UK have been diagnosed with the condition, so today we're aiming to understand how you can live well with atrial fibrillation. We'll be joined by BHF-funded scientist Professor Andrew Ng from the University of Leicester, who's going to talk through his research into creating an innovative virtual ward to support those living with AF. We'll also be joined by senior cardiac nurse Regina Giblin, who has worked at BHF for 10 years, helping to support patients with a wide range of heart and circulatory conditions. She's going to share some helpful tips and guidance on living well with AF. But first, I'm delighted to introduce James Robson, an experienced athlete who will share his story of being diagnosed with AF in 2022. He'll be joined by Sarah Marsh from the BHF Heart Stories team to discuss how he manages his condition while also preparing to represent Great Britain at the Rowing World Championships later this year. If you have any questions for our 3 speakers today, we'd love to hear them. If you go to the Q&A tab at the top of your screen and then click the drop down and select Ask a Question, you can submit your questions throughout the talks and we'll put them to our panel at the end. But without further ado, welcome James and Sarah, over to you.
Thank you so much, Fergal. Thank you so much for being with us, James, today. You're such a busy guy, we really appreciate it. Also wanted to say, these are live events. My Wi-Fi just dropped out. So if for some reason, I'm sure it won't happen again, my colleague Ruth will step in and take over the interview, but I'm sure it'll all be fine. So James, thank you so much. Lovely to see you. You've always been an incredibly sporty guy. You took up rowing at 17. And I wondered if you could start off by telling us when you realised that you could make it to the elite levels of this incredible sport.
Yeah, thank you very much. And thanks for having me. It's an amazing opportunity to talk about AF and my sporting career. So yeah, I started rowing when I was 17. I was doing a bit of stuff on the rowing machine just to try and keep fit. And one of my mates was in the rowing team and said, I think you should come and give it a go. So yeah, I went down to the boathouse for the first time and sort of picked up an oar and started rowing. And then I got to university at Newcastle, which has an amazing rowing program. And throughout my first year, I got pretty strong. I mean, I'm a pretty big guy. And at the end of that first year, our head coach sat me down and said to me that he thought I was good enough to go to the Olympics if I set my mind to it. And so that was me then committed. And that was 12 years ago. So
Wow.
Here we are.
Here we are. I was just going to say, I mean, your sort of list of plaudits since then is amazing. You were first reserve at the Paris Olympics. You're now training for the Rowing World Championships in Shanghai, which is incredible. And you're someone who trains early mornings, late evenings, and you're also studying for an MBA at Cambridge University. So your schedule is jam-packed. Literally scheduling half an hour meeting with you because you're such a busy guy, and the level of effort you have to put in for this incredible high level sport you do is so impressive. But you're in incredible shape. You were, as I say, first reserve at the Olympics. You're not someone most people would assume had a heart condition. And it's such a good advert for what we always say at the BHF, which heart conditions can affect anyone of any age at any time. Have you ever had people respond with surprise when you say that you do have atrial fibrillation, James?
Yeah, I mean, I think it was to be honest, I responded with a bit of surprise when I first felt it. In 2022, it was something, I was 28 and didn't think it would be something that I would be thinking about for a few years, but I was out training with my pairs partner at the National Training Centre in Caversham, and we we're very hot on having heart rate monitors on the entire time, and we take ECG tests sort of regularly to try and keep an eye on our heart health. But the British team, that's something that we're really keen on, is making sure that we understand how the heart's working, because it's the most important part of our training. It's the system that we train the most. And so, yeah, I was rowing around and sort of felt this irregular heartbeat. My heart rate was quite high. I looked down at my watch and I could see that for the kind of training that I was doing, my heart rate was sort of out of the normal range. And to my pairs partner's credit, he's a fantastic guy, a great friend, and he sort of calmed me down, and we went into the side of the lake and went in, took one of the handheld ECG tests, and found out I was in AF, and so took myself down to the hospital to confirm everything. I mean, we've got an amazing medical support staff, but I mean, I guess the BHF has been amazing sponsoring the boat race, which is what I've been training this year for. Yeah. And some of the stories that have come out, and obviously the work that I've done with the BHF in some of the activations that we've had at the boat race events, I've been inundated with messages, to be honest, of people who are sort of surprised and pleased that someone was out there spreading the awareness of the condition, and hopefully I'm able to show people that an AF diagnosis is not the end of any sort of fitness or sporting journey. It can be a small part of it.
Yeah, and like as we talked about before, really the start of a new chapter, but not the end of your sporting career by any means. And you mentioned that you were, obviously when you were diagnosed, you had been training with the British team at your base near Reading. When you were taken to the Royal Berkshire Hospital and were told that you did have AF, how did you feel at that point? Do you remember? Were you sort of shocked? Did you feel quite nervous? I just wondered in that moment, sort of what emotions you were coping with.
Yeah, I think it's a great question. I think I was very lucky that I had a great team around me. Obviously, my pairs partner Will, who I've mentioned, and then the medical, my training base, and the amazing doctors at the Royal Berks. They were very good at making sure that I felt secure and comfortable and reassured that nothing bad was going to happen, and it was a condition that we could get under control and wouldn't affect my training too much. And then it was a situation of, as I was starting to reintegrate back into training a few days later, members of the British rowing team that had had similar heart conditions were coming out and messaging me when they'd heard from friends or colleagues that I was experiencing these symptoms. Then, I got texts from people who had, were my idols. They'd been to the Olympics, they'd been to the World Championships and things like that, and saying, I had this and it didn't stop me and it won't stop you, don't worry. So, I was incredibly fortunate. But I mean, I think it was surprising, to say the least, and it was something that, as I said, I wasn't expecting. But quite quickly, the sort of athlete mindset took over, and I was like, right, well, this is something I've got to deal with and move on, and it'll be part of me, but it won't define me.
Oh, absolutely, and such a brilliant way to put it. It wouldn't, that one condition was not going to define you. You were prescribed a drug called flecainide, which you only take as needed. And you've explained that to me as sort of as a pill in the pocket approach, which obviously it's different for everybody. That's your approach. How does that work for you?
Yeah, so I was fortunate again through the British rowing team. We have a consultant cardiologist that's based in London, Professor Sanjay Sharma. So I went and did some testing with him. And I was expecting it to sort of be a nice calming afternoon where I was sat there and getting an ECG or something like that. He ended up putting me on a bike and making me do a hard 20-minute test. But it was good that the heart held up under all of that stress. So once we'd done that and we determined that it wasn't something that was brought on by exercise per se, it was sort of a bit more random, then the flecainide pill was what we decided to settle on. And I have it in my kit bag. It's right here. I've just come from training to do this. So it comes with me to all of my training sessions, to all my lectures here at Cambridge as well. And if I feel that I go into and I start having an AF episode, then I'll take a pill as soon as I can. But yeah, I mean, it's pretty non-intrusive thing to make sure that's in my kit bag, and it's just sort of part of my routine now to check.
Yeah. You mentioned Professor Sharma. You're also under the care of the GB team doctor, Dr. Anne Redgrave, wife of Sir Steve. I love that detail. So you're really well looked after. How often do you have sort of checks and ECG tests now?
So everyone in the British team has a regular ECG. It's once every 2 years, obviously, because I've got a history of AF. Mine comes around a little bit more regularly. And the other thing is that anytime I have an episode, I'm in direct conversation with Anne immediately. So I'll either message her or give her a ring, and then we'll meet up the next day and we'll take a look at some of the things that were going on around it, and add to our management strategy moving forward. But as I said, like, incredibly lucky that Anne is sort of available to talk about it, and she's been a great help for me and a sounding board, especially if I've had moments where I've been a bit anxious about it, because it can be a little bit daunting, especially going into the Olympic Games last year, where I was sort of thinking, what if this happens? But she was very comfortable. She was very good at reassuring me and making me feel comfortable all the way through. So I can't speak highly enough of the entire medical team at Caversham.
Oh, that's amazing, and great to know that you're so well looked after. The first sort of year to 18 months post-diagnosis, you had AF episodes every couple of months, I think, and you did actually experience one at the Paris Olympics, as you just touched on, although thankfully you haven't had one now for around 9 months. So in terms of your training and, when you were at the Olympics, how did you manage that? Because, as you say, that would be quite a daunting thing, but you took it in your stride.
Yeah, I think it was, there have been a couple of instances where it's been looking at how, like, the situation that it's been brought on in, if that makes sense. Like, what I was doing, what environment I was in, and trying to make sure that I was controlling those environments, especially around racing. In the first 18 months, it was a little bit more frequent, and thankfully since then it's started to become less so. I guess that's also coincided with our management strategy getting better and better. I've made a couple of lifestyle changes. I sort of make sure that I take care of my mental health a little bit more. I meditate every day. I manage my caffeine intake as well a little bit better. I mean, I still enjoy coffee, so I haven't cut it out completely, but I am certainly not having 5 or 6 cups before midday. But there have been a couple of things that we've managed to tweak about my daily life that have made the incidence of AF episodes sort of less frequent, and it can be a bit unsettling when it does happen, but once again, I'm surrounded by a great team and a great group of people that calm me down and make sure that we're ready to go fighting fit the next day.
Brilliant. I wanted just sort of last few questions, really. First of all, I wanted to ask you what it was like being part of the men's winning crew at the boat race this year. Such an incredible achievement. That must have been an amazing milestone for you.
Yeah, it was. It was an absolutely crazy day. There was so much going on. I mean, there were 250,000 people on the bank watching the race, and it was just a real day of managing your emotions. Every time you did anything, there were hundreds of people watching you, or thousands of people watching you and shouting for you. We were sat on the start line for 12 minutes more. I think it was 12 minutes more than we were anticipating, because there was some debris in the river. So the tension was building and building and building. But my mum was at Hammersmith Bridge watching, and a couple of days before she told me to make sure that I was ahead when we got to Hammersmith, so that she could relax. That was all that was going through my mind for the first half of the race, was make sure that mum can enjoy the second half nicely. So no, it was an amazing day, and it was so wonderful to see so many of my friends and family sort of in town to watch in person, and nice to have my little nephew running around with his Cambridge jumper on. So yeah, it was a great day and something I'll never forget.
Oh, incredible. And in terms of what's on the horizon, we touched on the fact that you're training for the World Championships in Shanghai. you are likely to be part of the GB crew at the LA Olympics, distant horizon, but that's so exciting. But also you're getting married, aren't you, to your partner, Lorna? So no rest for you. It's really busy.
Yeah, I was looking at my life 18 months ago and thought I need another challenge. Rowing and doing an MBA at Cambridge isn't quite enough. So planning a wedding was something that I thought we might as well throw in there. But yeah, we're very excited, and it actually coincides with, it's the week after the World Championships. So I'll be flying back from Shanghai on the Monday, and then quite jet lagged, trying to make sure that everything's in the right place for the Saturday. So I imagine that will be quite a stressful week, but I'm very, very much looking forward to it.
Oh, amazing. Well, all our best wishes go to you both for that, obviously. And just final couple of questions, really. Sort of combined, I suppose, into one. Why is it so important to you to support the work of BHF? Because you have been an incredible supporter of the charity. And what do you want to come from sharing your story, your personal experience of AF?
I think rowing is a sport that, as I mentioned earlier, is a cardiovascular sport in its nature. And hundreds, if not thousands, of people do it around the country, and it's a great participation sport. And so if I can spread awareness a little bit about the fact that people with heart conditions can still participate and compete at any level, really. I mean, I'm doing it at the highest level, but anyone can go and get involved with rowing and go down to their local club and learn how to scull, learn how to sweep row, and become a part of an amazing community that rowing is. That's something that I really wanted to do. And then I think on the broader point, like, the British Heart Foundation has done amazing work. I've been fortunate enough to work with Professor Sharma, who's a BHF, has had BHF funding, and my path with it, my journey with AF has been significantly smoother because of the BHF's work. And so it's absolutely the least that I can do to come on here and do as much as I can to try and spread the good word of the BHF, but also show that people with heart conditions, as we said earlier, it doesn't have to define you, and it can be the start of the next great chapter.
What a lovely note to end on. Well, thank you so much for finishing training in time for being here today. We really appreciate it. And with that, Fergal, back to you.
Thanks for sharing your story so openly and honestly today. Our next speaker is BHF's very own Regina Giblin, a senior cardiac nurse with a wealth of experience in supporting people with heart and circulatory conditions. I'll hand over now to Regina to take us through some useful tips and guidance for how to live well with AF.
Hello, everyone. My name is Regina Giblin. As Fergal said, I've worked with the BHF for nearly 10 years as a senior cardiac nurse in the clinical support team. I have just a few slides to talk about what is AF in the first place and a few facts about AF, and then I'll talk about some tips and triggers for AF. So I'm just going to share my slides now. Hopefully that will work. Okay, so what is atrial fibrillation? So atrial fibrillation is a heart rhythm disturbance. So basically, it's when your heart rate is going irregular and either too fast, usually is too fast, or it's going too slow. Our normal heartbeat starts at the top of our heart, at the right atrium, one of the chambers of our heart. And we have an electrical conduction system that starts at the top of the heart, travels down to the middle of the heart and into the ventricles, the two lower chambers of the heart. And this electrical current makes our heart beat. And then the heartbeat then pumps blood out of the heart to the rest of the body. And that's what the heart does. So with atrial fibrillation, what happens is lots of places up in the atriums fire off, uncoordinated. Some of these signals get through to the ventricles, and that causes them to twitch or fibrillate, and that's where the name comes from atrial fibrillation. Now, thank you for James for sharing your story, because what I was going to say was some facts about atrial fibrillation is that it can happen to anyone, even if you're fit and healthy, just like James is. So that's one of my facts I was going to share. Other facts are that most people with AF have no symptoms as well, and it can happen to anyone even if you're fit and healthy. But certain people are more prone to experiencing or having AF people with coronary heart disease, people with heart valve disease, and some people with lung conditions such as COPD could be more at risk of developing AF. And as Virgil said at the beginning, more than 1.6 million people in the UK have AF diagnosed. We do know there's probably lots more people who have it and don't realise it yet, just because sometimes it doesn't have any symptoms. And people with AF are 5 times more likely to have a stroke. So it's important, if you do have AF, to have a discussion with your GP or your cardiologist about the risk and prevention of stroke, because you may need to start some medication called anticoagulation. But with the right treatment and lifestyle, you can live well with AF. So some of the symptoms of AF are palpitations, or feel like your heart's racing. You can feel it in your chest, or you may hear it in your ears, and your heartbeat feels irregular. You may get dizziness, or you may have some fainting episodes. You get short of breath, and you get fatigued, especially when you try to do any exercise. And some people also get chest pain. So if you experience any of those symptoms, please pop along to your GP to have an ECG done to check to see if you've got atrial fibrillation. So there's different types of atrial fibrillation. It starts off as coming and going, which we call paroxysmal. Paroxysmal AF is usually, the symptoms last less than 7 days. Then it becomes more persistent. At this stage in persistent AF, you'll start doing treatments such as medication. And the AF episodes are becoming more frequent, and they're lasting longer than 7 days. And then it becomes long-standing, and then eventually it becomes permanent. When you're in permanent AF, you've got AF all the time. You may not have the symptoms all the time, but hopefully you have it controlled with medication or any other treatment strategies that your team have put forward. It's important to note that everyone will have different treatment strategies for AF. No one set treatment will suit everybody. And it starts off, as I said, coming and going, and then it becomes more persistent, and then eventually it becomes more permanent. So I've gone through. Okay, so we'll move on now to the lifestyle and the triggers of AF. So as James mentioned, his atrial fibrillation occurred when he was resting after he was doing some exercise. So exercise can trigger AF. However, we do recommend that people do continue to exercise when they do have AF, but you have to exercise in a safe way. So if your atrial fibrillation is coming and going, like as in a paroxysmal AF, we would say then to do the exercise when you're not in the middle of an episode, and to rest and listen to your body until your atrial fibrillation has subsided, and then you can do some exercise when you feel well enough. Exercise that we advocate is a moderate intensity. That means that you're able to carry on talking, but a little bit short of breath, and your heart rate is raised. So always go by how you feel. It's really hard to measure heart rates when you've got atrial fibrillation, because some heart rate monitors don't pick it up very well. So always go with how you feel with regards to exercise. And also, do exercise that you enjoy so that you continue to do it, and do it regular and often. So it might be hard to start an exercise regime. So make sure, you do talk to your doctors about how stable your AF is, and whether you have medication that help bring down your rate. It's also hard to exercise if you're on beta blockers, for example, because they do slow down your heart rate, and you may not feel like exercising because it slows down your heart rate. It kind of gets rid of that get up and go. But exercise will help manage your atrial fibrillation and the symptoms, and reduce the amount of times that you experience your AF. So other triggers as caffeine, which has been mentioned as well by James, but caffeine for some people can really affect them with regards to triggering their AF. If you're one of those people that does get caffeine triggered AF, then please think of other alternatives to caffeinated coffee or tea. Think about other food groups that may contain caffeine, such as chocolate, energy drinks, Coca-Cola, things like that. So may limit the amount of caffeinated drinks. But if you don't get affected by caffeine and you don't feel like your heart rate is changed, then you can continue your caffeine. Our advice for caffeine is between 4 or 5 cups of tea or coffee a day should be okay. Research has found that people who are overweight or in the obese category can have increased risk of atrial fibrillation. we're trying to find out the reasons why people are thinking it's because the heart's remodeled, because there may be some fat tissue around the heart, or it may affect the electrics. But also when you're overweight or in the obese category, it means you're higher risk of having hypertension, diabetes, and other risk factors towards developing AF. And when we're in a right weight, then our heart can work better as well. So it's important to try and lose a bit of weight if you can, because it'll help prevent the episodes of atrial fibrillation, and it also will help prevent having AF in the first place. Spicy food's another trigger for some people. When we eat, some nerve endings from our gut sends a signal to our brain to say, start the digestion process. These nerve endings can also surge a nerve conduction system to our heart, which is quite strong, and that can trigger the AF. If you find that spicy food does cause your AF, then it would be important to do a food diary and maybe work out what other foods you could have instead of the foods that causes the AF. So emotional stress, this is quite a big one, because AF can cause you to have emotional stress, because it's very daunting and difficult when you first get a diagnosis of a heart condition, but also a heart condition that comes and goes. You don't know when it's going to happen. You may feel lack of control. So there is high risk of anxiety and depression when you first have that atrial fibrillation. And also being stressed can cause AF, because when we're stressed, we're in fight or flight mode. It means our heart rate goes up, our blood pressure goes up, and that can also trigger AF. So think about coping strategies if you feel like AF is triggered by your emotions. So things like mindfulness or meditation, and maybe talking therapies may be helpful as well. But also make sure you talk to your family about having atrial fibrillation. It is a lifelong condition. It can change. The treatment doesn't stay the same, and it's hard sometimes to get your head around that. And it's important to talk to your family and friends about how you're feeling, but also your team of doctors as well, your GP and your cardiologist, because you need to work together and have good team communication so that the treatment is patient-centered for you. So drugs and alcohol, some illegal drugs such as amphetamines and cocaine can trigger AF. We've also found that alcohol can trigger AF as well, even in moderate amounts. So AF episodes are reduced if you eliminate alcohol, but just be careful with that one. Smoking, the more cigarettes you smoke for the longer period of time, it shows in research that AF episodes are the more risk of developing AF can happen. And blood pressure and cholesterol, it's important to know what your blood pressure is, what your cholesterol is, to try and encourage a healthy lifestyle all together. But having high blood pressure and having high cholesterol also increases the risk of having AF. So overall, I would say have good team communication with your doctors, have a team support system at home so that you can talk to people about how you're feeling. We do have an emotional well-being hub on our website that you can contact. The details will be in the chat or in the Q&A section, a link. There's also a Health Unlocked community online peer-to-peer support. The helpline's available. You can give us a call. I work on the helpline as well. And what I would say is, overall, having a healthy lifestyle does help manage your symptoms of AF, but also helps to prevent AF. So things like exercising regularly, having a healthy weight, a good balanced Mediterranean diet. If you do smoke, to stop smoking, try and reduce or eliminate alcohol, and also have a think about how you're feeling about having AF. So that concludes my part of the talk today. So I'm available for a Q&A at the end as well. So thank you very much for listening.
Thank you, Regina. And now I'd like to introduce our final speaker, Professor Andre Ng. Andre's BHF-funded research aims to support people living with AF through an innovative virtual AF ward. Andre is the expert, so I'll let him tell you more. Welcome, Andre.
Thank you, Fergal, and thank you to the BHF team for the invitation to talk to you about what we've been doing at Leicester in setting up a virtual ward for patients with acute atrial fibrillation. So we've heard stories from James about his condition, which is as a very elite athlete, having atrial fibrillation. We've heard from Regina about some of the triggers and risk factors for atrial fibrillation. I'm going to come from an angle where I am a hospital doctor treating patients who are referred to me with atrial fibrillation. So this is probably at the kind of more severe end of the spectrum, where patients are unwell enough that they either present acutely to the hospital, or they are referred for further treatment that they need more than just maybe tablets to sort out the condition. So I'm just going to try and see whether this is going to work. I hope you are seeing the slides now. I think we've already heard from Regina about what is atrial fibrillation. It is when the heart rhythm is no longer normal. Typically, the top part of the heart, the atria, beat very fast. It may be 300 beats a minute. It goes down to the bottom chamber, but it doesn't go at 300, but it's still fast enough for the patient to feel unwell with a fast heartbeat and sensation of palpitation. And we've heard about the increased risk of stroke with atrial fibrillation. I think that is the main thing to sort out if you have additional risk factors that put you at the high risk category that needs blood thinners. So this is a paper from 2019, just before the pandemic, about the EU figures for atrial fibrillation. And they projected that by 2060, the EU will have 14.4 million people with atrial fibrillation, largely because of the fact that we are living longer. And if you have a longer lifespan, you have more time to collect other conditions that will be associated with atrial fibrillation. So at that time, we estimate, this paper estimated that there will be about 1.8 million people in the UK with atrial fibrillation. But you've heard from the BHF report that we are already at 1.6 million. So we are already in the future. And the risk of having atrial fibrillation lifelong was 1 in 4 people, is now increased to 1 in 3 people. So the chances of anybody having atrial fibrillation is very high, and it's certainly the commonest heart rhythm condition that we see clinically. And atrial fibrillation consumes a lot of the health budget. This paper here estimated 1.44 billion, that was in 2020, and 60%, a majority of that AF cost are due to hospitalizations. Why do people come to a hospital? It's because when atrial fibrillation strikes, it can be fast, it can be irregular. You've heard about the symptoms: chest pain, breathlessness, dizziness. Sometimes patients may faint, although it's not very usual, but they can feel dizzy. So when their heart rate is very fast, they come into the hospital. We normally would keep them in the hospital for a few days, try to start some medication to slow down the heart rate, and we may decide to give patients medication to convert them back to normal rhythm. And to make sure also they don't have any other conditions that may have triggered the atrial fibrillation, because atrial fibrillation can be associated with other conditions which may need separate treatment. So we set up the project at the beginning of the virtual ward to ask the question whether we can actually treat atrial fibrillation in the patient's home if they don't actually need to stay in the hospital for any other reason other than the fact that they have fast heart rhythm and irregular heart rate. So we did an audit at Glenfield Hospital in Leicester, and we found that over the period just before the pandemic, year on year, we had 10% increase in patient numbers admitted with atrial fibrillation, and just before the pandemic, it was just under 1,500 patients admitted with atrial fibrillation to Glenfield. So we did a 2-month audit over 8 weeks. We found that the 200 patients were admitted with atrial fibrillation, and up to half of them actually did not have any other condition associated with atrial fibrillation. So they could potentially be managed at home with digital health technology, and also with our daily ward round conducted virtually. So this is talking about a new model of care, managing the patient at home rather than in the hospital. So we need to set up some criteria. So the patients, as I said, do not have any other conditions that they need to stay in the hospital for. They are generally stable otherwise. They're not in heart failure. They're not gasping for breath. So we can manage them at home. So they do have a fast heart rate. That will be the entry criteria. And then we decided to treat them with the virtual ward rather than keeping them in the hospital. In terms of virtual ward admissions, there are two types. One is the patient who had been admitted to the hospital, we then discharging them early and managing them at home. So this is called step down or step across, as my team would call it. The alternative is patients who pitch up at hospital, but they do not need to be admitted yet, but we are in a position to convert them into a virtual ward admission. This type of admission is called step-up admission. So how do we actually do that? We actually send the patient home with a number of gadgets to then also teach them how to use those gadgets and communicate with our team virtually over the digital platform. We use a device called a life cord. This is a business card type size device with 2 metal plates that you can put your fingers on. And this actually records a medical grade ECG that you can use to record the ECG during that period and to communicate with the digital platform, which then sends into our team, and our team in the hospital can then see it. And also you can use the Bluetooth blood pressure monitor and saturation devices to send the biological markers and parameters to us. And we would conduct a virtual ward round twice a day over the digital platform, much as we would do if the patient were in a hospital bed. So we also allow the patients to actually ask any questions, and our team and the hospital will be actually answering them through the platform. The platform also registers how well the patient feels. Obviously, at the beginning, when the heart rate is fast, we will have some color markers to flag up some red flags. And as the patient responds to treatment, the heart rate goes down and they feel better, then actually the boxes go green and they will be ready for discharge. And the virtual ward is managed by a team of advanced clinical practitioners. They are specialist nurses with who are experts in managing AF. They're overseen by a consultant cardiologist and also with support by cardiology registrars. At Leicester, we've been running it 7 days a week, 9 to 5, and we have out of hours support from our cardiology registrar out of hours. At the get-go, we have been mindful that quite a lot of patients with atrial fibrillation are of an elderly age group. So we are very mindful that we need to make sure that they are able to use the facility through the digital platform. If they don't have a tablet or digital phone or smartphone, we will be able to loan them the devices during the admission with the virtual ward. And also, we are quite proud to have adapted our digital device to be able to help patients, even with visual impairment. There were 3 patients up to now who've been registered blind, who've been actually cared for on our virtual ward. And also, all the patients are completed the monitoring until the discharge. Also, at the beginning, we also managed to get our digital partners to talk to each other to facilitate the recording of ECG within the digital platform, and it's now become an industry standard in most of the virtual wards now. So this is a kind of a spread of our patient group. The majority of them are in the 60s and 70s, more men than women, and also that's the ethnic spread on the right-hand side. It is fine to be able to talk to patients to monitor their heart rhythm and rate, but we need to be able to treat them. So we set up a facility which allows us to use e-pharmacy and also to talk to the patient's local pharmacist and to have prescription collected from the local pharmacist so that they can actually get the tablets that we want to prescribe. And we also managed to link into the GP electronic health record system 1, to allow all the records to be linked up to primary care. To date, up till March, we have admitted and helped just under 600 patients on a virtual ward. The majority of them are actually step-up admissions. That means the patient haven't even reached a hospital bed. So we avoided the admissions, which is 344 admissions. And the others were early discharges. We managed to discharge them early, and we have estimated that we probably saved around 2,000 bed days over this course of time. And based on our economic assessment, each virtual ward admission is saving about £600. And even with our current numbers, we are estimating that we have probably saved £220,000 over that 2-year period, 3-year period. We also aim to improve our service as we went along. So we carried out a patient and family feedback event to take on feedback from the patients and their carers. And most of them are very positive. The patients were certainly appreciative of the close rapport that they had with our team, and also the fact that they can ask questions. And also the friends and family test that we use all came back very good or good. And the patients were very confident in feeling empowered to look after their own health, and certainly appreciate being managed in the comfort of their own home with hospital level care, and also reassured by the care of specialists. The patients certainly feel better. The heart rate's better managed at the end of the stay in the virtual ward. Blood pressure is much better, and quite a lot of them went back to normal rhythm by the time of discharge. And more importantly, a lot of them have got definitive destination therapy decided by the time they leave the virtual ward. Is it safe? This is an assessment done by an external company called Niche, with funding from our East Midlands Academic Health Sciences Network. And at 30 days, we found that the virtual ward care is at least as safe as traditional care in the hospital. And by 90 days, actually, the virtual ward fares better, and there are fewer repeat readmissions or emergency admissions in patients being cared for in virtual ward compared to traditional care. So we can safely say that the virtual ward is at least as safe as usual care. And what is more important is that for patients who have been admitted to the hospital with fast atrial fibrillation, they normally need to meander through the system to get referred by the GP into a specialist before they can see a cardiologist and determine on this destination therapy. But in our virtual ward, we basically shortcutted the whole system and made it a lot more streamlined. And we certainly found that patients who have been managed in the virtual ward, when they have further treatment like a pacemaker, cardioversion, which is DC shock, electric shock treatment, or ablation, they are actually having it much sooner than otherwise if they were on an elective waiting list. And certainly 50% of patients who are referred for a procedure by the virtual ward team had the procedure done within 10 weeks. And with that, we actually got acknowledged by the HSJ and got an HSJ award in November 2023 in the Acute Sector Innovation of the Year. And also, we wanted to now do an upscaling work to try and show that we can upscale and roll out our format and our model of AF Virtual Ward from Leicester to beyond Leicester into other NHS sites. So the British Heart Foundation has given us a new research award, which is a Healthcare Innovation Fund, and we are involving 3 other NHS sites to show that our model of care in terms of virtual ward can be applied to other regions in the UK, in other hospitals, which include district general hospitals with and without AF specialist care on site. So we've just started this 2 months ago, and we hope to finish the project and come back to report on the next steps. The aim of this is actually to form a blueprint that can be used and adapted by NHS sites which are wanting to roll out and use an AF virtual ward for acute patients admitted to the hospital with AF. So with that, I hope I've shown you that the acute virtual ward is an innovative, safe, and effective system, and it's very well received by patients with excellent feedback. The patients feel ownership and confidence in managing their own condition. At least in the early data, has shown good clinical impact with reduced length of stay and cost, and also avoiding hospital admission. I just acknowledge the work of the whole team, and there is a virtual ward website that you can refer to, www.afvirtualward.co.uk, and we have a Twitter feed, and I would welcome any questions.
Andrew, thank you very much. Fascinating stuff. We'll now welcome back all three speakers for the Q&A session. And if you have any questions, by the way, you've had loads of questions, but we've got them in the panel beside me here. So welcome back, Regina. Welcome back, James. And Andrew, thanks for staying on. I'm going to kick off with, sorry, I won't choose now what the questions are. You have chosen because we're going for the most upvoted ones. I'm going to kick off with one. I think Regina's probably answered it, but I'll just give you a quick second to look at it, Regina. This is concerning the triggers for AF, and they're talking about coffee and alcohol. But in this person's experience, this isn't consistent. Are there any other things that maybe haven't been mentioned that can trigger?
So every individual is different with regards to atrial fibrillation and its triggers. I think the important thing is to monitor it and record it. So as I mentioned in the talk, like spicy foods sometimes can trigger it, emotional stress can trigger it, doing too much exercise can also trigger it. People sometimes get dehydrated, especially in the hot weather, that can trigger AF. So the team approach, basically in communication with your doctors and your arrhythmia nurse specialists and your cardiologist to make sure that, we understand what your triggers are and ways to alleviate those triggers and to manage your life so that you can carry on living the best life that you can, and being on the right treatment at the right time.
Okay, thanks very much. Now, we're not going to go for Olympic standard here, James, but there's a question in asking, how do we keep active and get fit again with AF?
Yeah, it's a great question. I think my advice would just be that I don't think it has to stop what you're doing. And I think if I'm a massive advocate for people having an active lifestyle in general, and I think rowing's a great sport. So if you've found a local rowing club, please go out and try it. But any exercise, even the sort of lower intensity stuff is great. And that's predominantly what I spend most of my life doing, is training at the low intensities. And so, I think even if it's going out for a walk and getting out in the fresh air, I think that's a great first step.
And one individual here is talking about playing golf, and says occasionally when they're playing, they feel AF has kicked in. Feel free, any of you, to come in on this, but is it okay to continue playing in this state?
I would say it depends on how they're feeling. And it also depends on how their AF is treated as well. If they have AF a long time and it's usually in a stable rate, and then it might be worth trying to contact your doctor to find out if there are any other treatment strategies to help to carry on with playing golf. If your AF is coming and going, then it's probably best that if it's coming more frequent, then again, the treatment strategy may be different. Is there anything else, Professor Ng, that I should mention about the golf question?
Yeah, thank you. I think that's a good question. I think it is, what I normally say to my patients is that on the one hand, they should not ignore it, because some patients prefer to take an ostrich approach. They ignore symptoms. Oh, it's probably going to be all right. I think it is important to diagnose atrial fibrillation early, because the earlier you know about it, the more that you can do something about it. The doing something may be very simple, or it may need more sophisticated treatment. But on the other hand, you don't want to be over paranoid about the whole condition, because we do know a lot about atrial fibrillation. First thing to say, it is on its own not a life-threatening arrhythmia. So it's not a life-threatening heart rhythm disturbance. It doesn't cause people to keel over and die suddenly. So AF is not that kind of condition. Although it can be associated with stroke, that's why an early diagnosis is important. And if you have additional risk factors that would mandate that you should be on a blood thinner, an anticoagulant, then you should start that. But we can't start that without positively diagnosing atrial fibrillation. So getting the symptoms looked at and early diagnosis AF is important. And of course, we can't stay in a cocoon. So we talked about a lot of the triggers, but clinically, when I talk to patients, the commonest trigger is no trigger. as we've seen in James's example, exercise doesn't trigger it. He can be just walking. He last had one 9 months ago, it was great, but quite a lot of patients and come to me and say, well, all of a sudden it happens because we're dealing with the electrics of the heart. And the electrics of the heart, just like in a light bulb, do you know which light bulb in your house is going to need replacing tonight? You don't. That's my analogy for my patient, but not to scare them, but just to say that we don't know. And you can't live under the cocoon to say, okay, I'm just going to meditate to 15 hours today. So to wish the AF away, you can't do that. But sensible living is important. Eat healthy, sleep healthy, and also to get enough rest and also adequate exercise.
And on the life-threatening element, Andre, I'd probably, I mean, I'm looking at the amount of upvoted questions there are here, and they are about keeping active and fit. And where can people get exercise? Get advice on setting up an exercise plan to keep fit whilst living with AF?
Yeah, I think cardiovascular exercise is good. Any cardio exercise in general that keeps the heart healthy is good exercise. But you shouldn't really go sort of all out to it to say, and again, to my sports patients, I said, well, you have nothing to prove. So being able to run 3 miles with AF doesn't mean that, oh, see, my heart is so strong. No. So if you have AF when you're exercising, you should stop and think, am I okay? Can I carry on? If you have a heart monitor, check what your heart rate is. If your heart is going at 180 beats a minute, you should stop. I think it's not a number, but it's actually common sense to say there's nothing macho about it and say, well, look, I run another 5 miles and I'm fine. No, well, you're stupid if you're doing that. So if you're healthy, you feel that I'm able to jog along because I'm feeling fine, then carry on, jog along. But you need to be mindful of your condition. So I think if it's newly diagnosed, you probably need some advice. But if you've had the condition for some time, you would probably have a good feel of how your personal state and your personal health is. And I think every new episode, you need to treat it as in, okay, last time it was like that, I didn't need to go to the hospital, or last time it was like that, and I needed to go to the hospital. So you need to be having that sense check. But if you need some advice, obviously there's Helpline. The BHF has got Helpline, and your medical professionals should be able to advise you on your specific condition.
Yeah, thanks for calling out the Helpline. Can Regina, probably quickly for you, difference between atrial fibrillation and ectopic heartbeats?
So everyone can have extra heartbeats. That can be normal for people. There are certain arrhythmias or heart rhythm disturbances that you can have a number of extra heartbeats that can cause a more serious condition. So atrial fibrillation is a certain pattern on the ECG. So it's not an extra heartbeat is a different type of complex. We call them these squiggly lines on the ECG or complexes, and an extra heartbeat is usually a wide complex. But an atrial fibrillation it's a very distinctive pattern. So it is quite different. You can have atrial fibrillation and have extra ectopics as well. So, or you can have normal sinus rhythm or normal heartbeat and ectopics. And there's very, it's quite varied what your heart conduction system or electrical system can do. So if you're worried about ectopics, then go along, see your doctor. You may need to have a monitor, like a 24-hour heart monitor, or a 7-day heart monitor if they're happening a lot. Because the extra ectopics could, you might feel a palpitation kind of experience, or you may not feel it at all. Some people just have ectopics and it's completely normal for them. So it's a different type of phenomena, I would say.
Okay, thanks, Regina. James, at any point did you feel like you shouldn't continue to row, or were you confident all along that this could be managed?
No, I've never had it was never really a question for me. I think, again, it speaks to the support that I had around me, that almost the first thing that people said to me was that this was not something that had to stop my career. So no, it was never something that I'd considered. I'm pretty sure my fiance would like me to consider it at some point, but I think, yeah, as I said, like it's part of my management strategy of AF is being active, and so it was never a thought that crossed my mind.
Thank you very much. Where would you believe it? The hour's nearly up, and there are loads more questions. Anyone with a name associated with those questions, we'll try and get back with answers to you. Remember that you can ring our Heart Helpline and go on to our resources on the British Heart Foundation website for answers that we provide, particularly around atrial fibrillation there, and of course all the range of heart conditions. But thank you so much. It's all we have time for today. And as I say, we'd encourage you to get in touch with our Heart Helpline if there's something particularly distressing you. I'd just like to say, I'm always blown away by the way that people who've got a particular condition are willing to share their story to benefit other people. And I'd just like to call James out for that. It's so important that individual stories, especially somebody at the peak of his career, is willing to take the time out of that busy schedule to share information with you. It's hugely valued. Heart Matters Live is a free quarterly Q&A series, and we strive to produce the best live events possible. Your feedback and comments are crucial to help plan and develop future events. So we ask if you can complete the survey that we'll send to you soon in the coming days. All our incredible research is funded 100% by you, the public. If you were inspired by what you heard today, then all donations to support our life-saving work are very much welcomed and appreciated. There's a link to donate in the chat box should you wish to do so. The edition of Heart Matters Live was recorded and will be available on our YouTube channel from next week. Our next event will take place on the 5th of August and will be focused on how you can reduce your risk of having a heart attack. Register now using the link in the chat box. But for now, thanks again for joining us, and goodbye.